Hello, I am Margie Taylor, your host for Conroe Culture News, FM 104.5, 106.1, live streaming irlonestar.com, and Facebook Live, Conroe Culture News. So in today's segment, we are going to talk about the joint venture between Meals on Wheels of Montgomery County and CenterWell Senior Primary Care. They're a new facility, and we're going to learn all about it from Lance and Aron. Okay, we want to make sure it's right. And we also have Jilian Lennon, the Compliance Director of Meals on Wheels, and Gary Kempker, and he is the Business Development Director from Meals on Wheels, Montgomery County. So, what brings us all together today? What's going on with CenterWell? Y'all are a new business, right?
That is correct. We opened our doors on December the 14th of last year. We are a senior facility.
Strictly seniors?
Well, 65 and above.
Okay, so that's seniorish.
95% of our patients. We do have some patients that are disabled that qualify. It's all Medicare Advantage patients. So we take Aetna, Cigna, WellCare, Memorial Hermann are all of the carriers that we take. So it's a payer agnostic facility that focuses on the holistic healthcare model, which we use a primary care doctor. Also, we have pharmacists, social workers, counselors. We have our own activity center. These are just some of the things that we provide inside of our center.
So what does that all mean, a holistic? I mean, I know in general that means taking care of the whole body, everything together, socially, developmentally, physically, all of that. But how is that different than going to your regular primary doctor?
So, like I said before, we have a pharmacist on staff who normally a primary care won't have that. And what they do for us is they'll go through medication review for the patient. We also, whenever they're discharged from the hospital, we do medication review, and they're there to assist the doctor with medication for the seniors. Counselors, are there, and also social workers. So if a person has issues that are related to food or housing or any of those aspects in their life, we try to help solve those also. So
wow.
We look at just...
So this is very innovative.
Right.
You're unique. It's not another facility really like yours, is there? I don't think so. Never heard of it.
Not in Conroe that I know of.
So is this the only one you have, or do you have other facilities?
We have 12 in the Houston market, and also we're in the Louisiana market for CenterWell. Our group, actually it's nationwide, but our region is Texas, Louisiana.
Very nice. Mm-hmm. So you have developed a partnership with Meals on Wheels.
That's correct.
And that is why we're all sitting here. So how did that work? How did that come to be?
Well, when we came to Conroe, I was looking for organizations that kind of fit our model and that we could partner with to help us reach out to seniors. And I felt that when we found Meals on Wheels here and I met Gary and Jilian, I thought it was a real good match for us and for them.
Yeah, you came in and you did a kitchen tour with us, and we showed our facilities, and we match up really well because CenterWell and Meals on Wheels both take a very holistic approach to all of our clients. So we knew that we would really match up really well.
So what are some of the things that you all are doing together?
So I think we actually helped with your... didn't we do mats that we bought for? Yeah,
so you guys, actually it started with, after you did the tour and we were talking, I had a client, and she's 105 years old, and she wanted to get the COVID vaccination, but she had all these medical questions that we cannot answer. We're not medical professionals over at Meals on Wheels. And what we did is I talked to her, told her, you need to talk to your doctor. Her doctor actually never called her back. And it was really frustrating. They have my cell phone number. Her husband called me at like 9 o'clock at night saying, we really want this vaccination, but we don't know what to do. At that point, I knew they were very frustrated with their physician, and I knew that the model that Lance and CenterWell has would be a perfect match. So I got a hold of Lance, and he got a hold of our clients, and they went down there, and I believe to this day they're still there.
Well, that's good because
That's
you
true.
need immediate response
And you
for the
do.
people you serve.
And you do. And when you're 105 years old, you don't want a doctor who's just going to take 5 minutes, take a look at you, and push you out the door. One of the things I love about CenterWell is that they take over an hour with their patients. They have a very
That's amazing.
limited number of patients that they can see a day because they want to give them that type of care where you actually do care.
And that's what really makes you unique too.
That is correct.
That it
So-
isn't just an in and out. That you only serve. What's the number? I know you have a number. How many patients you serve in a day?
So 12 is the
12.
limit. So our schedule's set up a little different from other primary cares. So we'll have a huddle in the morning from 8 to 8:20, and we'll just go over the patients that are listed there for the day. I'll start seeing scheduled patients until 11. That'll be physicals and people who are coming in for just regular checks for things that they're having issues with. And then from 11 to 12, we'll have walk-ins only. So if someone wakes up and they're sick, they come see us instead of going to the urgent care. We try to keep the door open for them also. So after lunch, 1 to 4, scheduled patients, and then I do walk-ins only from 4 to 5. So the most patients we can see, even when we schedule those walk-ins, is 12. That's
something.
coming from primary care, where we were fee-for-service. And when I say fee-for-service, our model is not based on fee-for-service. We get paid to keep patients healthy. And that's what the Medicare model. So we'll only see 12 in a day.
And you spend time with them. So
Yep.
what is your role with CenterWell?
This.
Talking, engaging with people and telling them what.
Yeah. Also, I also teach the model to, we do tours. I make sure that all of our doctors are understand the model. I reach out into the community.
It's a lot of outreach.
Yeah, and all outreach, yes. Yep.
Very good. So I do want to talk about where people can find you. So your website is CenterWellPrimaryCare.com, and you're also on Facebook for CenterWell Conroe, because a lot of people are on Facebook to look for information. And what is the way that they would make appointments? Do they have to go through their already medical insurance, or how do they do that?
Well, the way that our appointment schedules are is we do it in 2 steps. We do a initial visit, which they call a welcome visit, and then an initial visit where they come in to see the doctor. The first welcome visit is where the medical assistant will call them, and we'll get all their information that we can to save time for them to spend more time with their doctor. So when they come in for their initial visit, they're actually in face-to-face with the doctor most of that visit, instead of with the medical assistant asking questions about their back.
Right, how that
their
normally is. Yeah.
history. Yeah. So it's a 2-step process. They call us, we set up a welcome visit, and then an initial visit. And they can even sometimes be in the same day if they want. And sometimes we'll do them 2 or 3 days apart.
So they can personally then just call to make an appointment?
That's correct.
Okay, so that's easy too. So it sounds like it's a whole different interactive type approach to really helping seniors in a big way. And so by working with Meals on Wheels, that sounds like a perfect fit, because those are your people,
Those
right?
are our people.
So you can refer back and forth, and
Yeah,
if
and
somebody-
it's a beautiful facility, and a lot of our clients are on Medicaid, and they go to these offices where they're just not treated well. They go to CenterWell, and it's like a 5-star hotel when they walk in.
They love it,
I mean,
right?
they get the
Have you
the
been there,
customer
Gary?
service
Yes,
is-
I have. And I will say one of the primary reasons that we really like CenterWell was that they honed in on the nutritional values and needs of our clients and their patients. And Jilian can expand on that quite a bit, but that's what we're doing also at Meals on Wheels.
So one of the main focuses that we all know is that CenterWell wants to keep their clients out of the hospital. And we also want to keep our seniors aging at home also. The cost for a client to be on Meals on Wheels for 1 year is $1,500 per client. To stay just in the hospital for 1 day, it's over $2,607. So together with nutrition, we know that we can keep these clients healthy, we can keep them safe, they have the community connection, and they have the socialization. So
do you make recommendations as to what kind of foods Meals on Wheels should be providing to their clients?
We do. I don't.
So-
They have their own.
Right.
They actually they do a very good job with it.
Of course they do. But, I mean, you mentioned that you're working nutritionally, so I was just wondering, what does that look like?
I mean,
So we're working towards heart healthy meals for all of our clients. That's something that we're doing. We're working with the American Heart Association using recipes that they have provided for us. We're more than a meal. So it's more than just giving somebody something to eat, but we're teaching them to eat nutritious meals, how to lower their sodium. Coming up in September, we have Low Sodium September, where our chef is going to eliminate even more of the salt that he has. We're already at a very low amount, but if we can teach our seniors to learn how to season themselves, even if a couple start doing it, it's going to make a big difference.
It's about sharing and education.
It is.
And then I know you all do that, so that is a good partnership.
that is correct. We also have, the activity center that does allow. We do have.
Tell me about the activity center.
So our activity center is open to the whole community, but we do a lot of focusing on senior events. So we do a lot of bingo, and these are social events to help seniors interact with one another. We also do nutrition activity, so where we have people come in and we talk about nutrition, and we're actually partnering with Meals on Wheels to come do that with us.
So that's where the nutrition part comes in, is that
Right.
they offer the education and share that also with the
That's
seniors.
correct.
Okay.
And we're building our activity center now, so if you're in the audience and you do have something that you'd like to share with the senior audience, come and see me, and we'll see if we can put you on in our activity center. And we try to help whoever's doing that by supplying whatever they need, snacks and water and things like that to help facilitate that.
So you're about engaging in the community
That's
and
right.
helping seniors overall in whatever you can do. Well, no, I know that's fantastic. So I know that CenterWell will also be a sponsor of the senior luncheon that's served at the Senior Activity Center in September. I know we had kind of talked about that and getting more people interested in what you all do.
Yeah. And Leslie Guillermo is our community engagement.
She's awesome, yes.
Yes, and she'll be doing that with.
Right.
Yep.
So do you also have like some kind of physical activities that you do there?
We are trying to partner up with someone to help us with that now. We
Okay.
don't have any.
That's somewhere where you're going.
Yeah, we're
moving
trying to,
forward.
Yeah, we did have on some of the other centers where they had the ladies come in that worked in the chairs.
Yeah.
But we haven't set that up yet. COVID has kind of slowed some of our
Certainly.
things down.
Peaks and valleys
Yeah.
with that. That's just craziness. So I see that you also help with other challenges that seniors have, whether depression or loneliness or anything like that, which I know Meals on Wheels does too, because that's one of the things they offer more than a meal is going in there and checking on the seniors.
And that has gone up tremendously since in the past year that we've had a lot of people that we've had to refer over to counseling for that.
So you
And-
watch out for that when your
Yes.
doctors see people to
Yeah.
see overall holistically
Yeah.
what else is going on.
Yeah.
They might look physically okay, but there's
they-
other stuff going on.
They tend to open up to the doctors, and we kind of take it from there and run with it. It is I wouldn't call it a crisis, but it's elevated a little bit since COVID has come in, and
Sure.
we've noticed it and noticed a change.
Do y'all do senior assessments when you
Yes.
can tell someone is declining and might need a little
Yep.
bit more assistance?
Always. They do assessments on all the patients when they come in.
Physically and mentally.
That's correct.
Interesting.
Margie, one of the things that fits into the socialization side is the majority of our homebound seniors live by themselves, so you automatically have a problem. But they see very few people each day, so they see whoever ends up on their porch delivering food, but they develop quite a relationship with their animals, their pets. And we've partnered with the Texas Veterinary Medical Foundation, Meals on Wheels have, and we're going to launch a program for all of their pets to provide veterinary care for them.
Oh, that would be wonderful.
Yeah, because the majority of them live on fixed incomes and they can't do that.
Well, and
so
those costs are so high, even to
Extremely
take
high.
for annual visits.
yeah, extremely
Over
high.
$100. I just took my dog in.
Yeah, we're
And
excited
it's
about
a lot.
that.
So that's a terrific program.
Yeah.
I actually do delivery for Meals on Wheels on
you?
Tuesdays, and half of the would you call them participants? Or have animals, and
Yeah.
and it's one of my favorite things to do during the week.
Well, sure. They look forward to it. I totally understand that. My mother's 82, and her mental health is declining, and she's not easy to get along with. But she really needs that, and she needs people to look past that and help her out as needed. You know, they still need to eat. They still need interaction with people, like Gary mentioned. Social interaction is very important, and especially during the last year when they were locked in and couldn't get out, that changes your whole anxiety level and everything that goes with it. I mean, that tumbles into physical too. If you're not feeling good, maybe you're not eating, or you're depressed, or any of that. So I'm looking forward to coming by and seeing your facility. Now, are you having a ribbon cutting and stuff going on as well?
We do have an open house on the 30th.
The
so
30th,
that
okay.
will run from 11 to 2. So, and everyone is welcome
Okay.
to come out for that.
And this is August 30th right now. And so that would be great for everybody to come out and see your facility, tour it around. And so can you do independent insurance too, or is it just strictly Medicare?
We are a Medicare Advantage facility, so that they have to have Humana, Cigna.
And most do anyway when
yeah.
they get 65, right?
Well-
I'm not 65. I'm just asking.
Well, I'm not on the insurance side, so I don't know the ins and outs of that, but
Yeah.
I do know that they have different options that they can do at 65. And one of them is traditional Medicare, and then you can also opt into what the Medicare Advantage policies, which offer more access to health
Okay.
care. And that's why that's what our model is built on, is that access. Because, Medicare, just a traditional, is more of a fee for service, where you can go wherever you want. But when you opt into the Medicare Advantage side of it, you actually we will be your primary care. You'll use Dr. McKinnon as your primary care doctor, and we'll be your starting point for your health care, and we'll push you out from there.
So does your facility offer everything that a senior would need if they
Oh,
needed? You're saying that that's the place they go for primary care, and you have a pharmacist, which is fantastic, because then
Yeah.
they know the whole story and what drugs are already on, whether it's prescribed or over the counter or whatever. But if they needed additional services, would you then refer out?
We do.
Okay.
We do. Everything is referred out. We have a referrals coordinator that works with their insurance and makes sure that they're wherever we push them, wherever they're moved, whatever specialist they're sent to, or X-rays, or wherever they're going for anything that the
So you
doctor
can connect them,
orders.
whatever it is.
Yeah, and we make sure that it's inside of their network, so they're not hit with surprises, and that's really important, because we like to make sure that we do the extra to make sure they don't have
You take
any-
care of them. So are you affiliated with the HCA hospital right by you, so they can go there?
Yeah, of course. They have Medicare Advantage, so all the carriers they take over there.
So it's
So,
seamless.
yeah.
It makes sense.
Yeah.
Just asking the questions that somebody would ask. So just trying to get it
Yeah.
out there. So what do you think, Gary?
Well, Lance, they're able to answer almost any insurance question that a client would have. So if
Seems
they're
like, yeah.
if they're thinking about coming to the ribbon cutting ceremony, they should come in even if they don't have Medicare Advantage right now. They can answer the questions and make it seamless for them.
But when you go in person, it's so easy to see really the whole advantage of being a part of it, all the attributes that you all have in your facility. And, usually seeing is believing, right? You got to walk through so that you gain trust and see it and meet with, your staff, all of that.
And I actually do a tour any time. They don't have to wait. They can come any day. And we also give them a little gift card to come through and take a tour. So we'll take them. Anybody in the facility can do the tour. If I'm there, I'll be glad to give you a tour. And it takes about 10 minutes of your time. And
It's
all.
easy. So it's on 383 South Loop 336. But tell me, descriptive-wise, what that looks like. Where is that?
So if you're familiar with 336, there's HCA. We're across the street from them, and we're right in front of Kroger. So if you're in that new Kroger there.
So you're on the same side as Kroger?
We are on the same side
Okay.
as Kroger.
Okay. So over there by Kroger, Dick's Sporting Goods, and all that, kind of like.
We're right in front of Kroger.
Okay. Okay. So it's easy to find.
Yeah, very easy to find. Chick-fil-A's there if you know where that is.
Okay. Well, all right. So you go by Chick-fil-A, and then you're there at CenterWell in Conroe. So it sounds like a great opportunity for older patients because you can get everything done. You don't have to wait. You're respectfully listened to hear all of what's going on. You offer true assessments. You're working with Meals on Wheels, and who doesn't like Meals on Wheels? I mean, come on. In fact, more people need to like it, right, Gary?
That's absolutely true.
Absolutely.
That's absolutely true.
So the baby boomers are all getting older. I'm one. And I'm not there yet, but it's going to happen, right?
It's happening.
So I don't know the names of all the different generations and X and whatever, Gen Z. I don't really know where the cutoffs are exactly. But this is something that working adults need to understand that you really need monthly donations, right?
That's correct. 12,000 people turn 60 every 24 hours in the United States.
That's a lot.
That's a lot.
That's a lot.
So we need more CenterWells.
Now that a lot of parents are empty nesters, just started, say, this week, that a lot of them, I saw a lot of things going on Facebook and all these people taking their kids to college. They need another project, right? They need to get involved, and I know you have volunteers that do not just delivery, but they help with a lot of things going on. Decorating breakfast bags could be an opportunity, birthday cards. There's events coming up. The pumpkin shoot, and you need volunteers for that. But more than that, you need monthly donations.
We need monthly donations, but right now we're working on a program to convert hot meals. We have the majority of the meals that we send out today are delivered hot. Some of them are delivered frozen. But if there's any businesses out there that would like to contact me about a program I'm putting together for the businesses to participate in delivery, much like Lance does, just give us a call. Got to get everybody a hot meal.
And you can find out about Meals on Wheels on their Facebook page, or you can go to mowmc.org.
That's correct.
Right? So something I know a little bit about, and I'm looking forward to checking out your facility, Lance. And what have I missed? It sounds so unique. I don't think there is not a facility like this in what you do. I'm sure you're going to be too busy. And then what? Then do you just not take clients?
Well, our facility right at this moment, I have one physician, and I have 8 rooms, which means that I can go up to 4. Each doctor gets 2 rooms, so we're in the growing phase, actually the startup phase. But there's lots of room for growth. We have plenty of room for everybody right now. So call us and get on the schedule.
Well, very good. Anything else you want to add?
I just want to say that it's a highly impressive place. They have all the highest technology there. You know, when I did the tour, you have the patient's table that starts low, and then you rise it so that they don't have to jump up onto a table. And, you know,
Some things you just don't think about,
you really
right?
don't, but when you're sitting there, you're like, this makes sense.
Wow.
I believe you told me something in regards to
The monitor.
there's the monitor, and then if a patient doesn't pick up their medication, you guys actually follow up with that to make sure, was it a financial where you weren't able to get there?
Huh.
And
Well, I
that's
get a
just
list
taking another.
every day of all the patients that didn't pick up their medications. So that list goes to the pharmacist, and the pharmacist's job is to follow up and make sure that, and investigate. So why didn't you pick it up? And we're detectives at that point, to see if they didn't have a ride, if they didn't have the money to get it, and then we try to solve that problem. So
Do y'all deliver?
we don't actually do any medications there. We just, if they didn't pick it up at CVS.
Okay, so you write the script and
Yeah.
all that. Okay.
Yeah, so we don't dispense any medications
Okay.
in our facility, but our pharmacist's job is to make sure that, our patients are adhering to what the doctor prescribed and taking it accordingly.
Mhm.
Because the number one reason people are admitted in the hospital is medication overdose.
Hmm.
So, we ask that all patients bring in their medications so we can review them. And you would be surprised at how many people bring in something from 2 or 3 years ago that they still have in their medication. So our pharmacist we got to take that out. This is not part of your
Well, and
medication.
some of them they probably don't even need to be taking.
And that's true.
And side effects and all of that, because
Yeah.
I'll bet that a lot of times whoever they're going to doesn't know all the medications.
That's correct. Yeah, we help organize their life a little bit
Right.
with their medication. Yep.
That's very important. So, and I'm sure it's sanitary because that's a big concern right now. Everything is, do you wear masks in there?
We have masks all the time right now because of COVID, and right now it's on the up. It's on the rise.
Right.
So we're taking extra precautions.
You're careful.
Yeah. Yeah.
Are you doing vaccinations at the office?
Most of the locations are, because I'm new. I haven't been distributed any vaccines yet, but I probably will get some in our location, but not yet. But we do, right? You can get them anywhere at CVS, Kroger, next
Right.
door.
And they're going to be having
Yep.
booster shots too.
Yeah, and that's soon.
And probably the seniors, I don't know how that goes, but I'm thinking they might be eligible because I remember we were out there doing the vaccine, so that time will be coming up.
Yep.
Yep.
And we have transportation to get our seniors to get their vaccinations, and when they're ready for their boosters, we'll be ready to get them there too. So.
Yeah, and the great thing about Medicare Advantage is most of the policies now will also help you with rides to get to where you need to go, whether it be a specialist or our primary care. And if you're our patient, we also have a ride. We can help you with rides too.
Well, and Meals on Wheels has transportation services
We
as
do.
well.
Absolutely.
And that's kind of like a little secret that a lot of people don't know, but offer a lot of curb to curb.
But we do a lot of
House to
doctor's
house, wherever you are.
appointments. We have clients that are still able to get out and they can go to the grocery store. But they just can't drive anymore. We are able to help those people out. Anyone who needs a ride who's over the age of 60, we can help out. So all they have to do is just give us a call and we'll help them. The congregate centers are starting to open for people who want to get out. Bingo is becoming pretty big again.
Back in.
It
The
is.
Willis Friendship Center is opening fairly soon. Tomorrow will actually be their sign-up day if that's something that they're interested in.
And where do they meet
in
at?
Willis. At the Willis Friendship Center?
Yes, is that the community center on Gerald?
Yes.
600 Gerald?
Yes, it is.
Okay,
And
so
then-
that's right off the feeder.
Exactly.
Mhm.
And then Conroe, they just opened their Friendship Center up again, and they're doing really well.
The senior center, yes.
Correct. Yep.
At Candy Cane Park.
Exactly. So we're serving our Meals on Wheels meals for lunch for them. And this is something we haven't done for over 5 years. So we're really excited to start
That's
that
awesome.
back up again.
No, that's good. So,
Is that Amanda there?
yes, it's Amanda.
Yeah,
I work with
Amanda's
Amanda
on
too.
Conroe.
Yes. Okay, so thank you very much. Meals on Wheels. We have Jilian Lennon, who's the compliance director, and next to me is Gary, the director of development with Meals on Wheels, and then we have Lance Aron from CenterWell Senior Primary Care. I appreciate y'all coming on the show today and sharing the news about how there is help for seniors, healthy ways to take care of themselves holistically through a great partnership.
Thank you, Margie.
Thank you, Margie.